There are two types of home care agencies in the state of Pennsylvania that are non-medical. First one is called home care agency. Home care agency is a business that supplies, arranges, or schedules employees, that's the word, employees, to provide or perform daily activity leaves for clients in their place of residency, okay? In the consumer's place of residency or another place where they call home, okay? On the other hand, home care registry is an organization or a business entity that, as part of an organization or business entity, home care organization is a business that supplies, arranges, or refers independent contractors to provide home care services. When you submit an application for your home care registry or your home care agency in the state of Pennsylvania, there are some factors that they consider before they give you a license. One of them is policy and procedures. The home care agency or a home care registry must have a physical site location which is secure and private as its business location. It cannot be a home. Virtual offices are not allowed. Co-working or sharing spaces of offices are not permitted without a physical barriers, privacy barriers. The agencies using a shared space must maintain separate files. So if you get one company that has several agencies, you need to separate the files. BO boxes are not allowed. Okay. Agencies must operate and be open to the public during the posted hours. Agency must have a person designated to oversee the operations at the physical location during the posted hours. So you gotta have an office manager. Agency must provide services in the county of residency. Okay? Agency must provide services in the county of residence. Agency may only expand services in an area beyond adjoining counties. So if you are expanding beyond a county that's adjoining to your current county, then you need to get a separate license. This state does not have a branch extension. You need to get a separate license for a physical location. Okay? That means you can only provide services in your county and counties that are touching your county. And if you want to go further, you need to go get another license. Okay? No non-medical services are personal care, instrumental activity of daily living, and companionship. That's all you can provide with these two licenses. The home care agency license can provide personal care, instrumental activities of daily living, and companionship. Same thing with the home care registry. But there's also something called specialized care that can be provided with these licenses, but you need to classify yourself and you need to provide policy and procedure and training plan for calling yourself classified, for classifying yourself as a specialized care home care agency. So you can hire contractors 1099. You can hire employee as a personal care agency if you register that uh, properly. So 1099 means you don't pay the taxes. You just, if you give someone $30 an hour to do the job, well, you give them $30 an hour. You're not liable or responsible for the employer's taxes, and you're not responsible for withholding their taxes. They can just cover themselves. That's a great thing. I think that's a great idea. Okay. Employee means you are providing, you are withholding taxes and remitting to IRS and other agencies in the states. You are also paying and contributing to Medicare, Medicaid, FICO, and other things that you have to pay, okay, as an employer. Recap. Two types of home care agencies in Pennsylvania. Number one, home care agency, where you hire the employees, and home care registry, where you hire contractors.